My name's Georgie. I'm a paediatric metabolic dietitian from Manchester University NHS Foundation Trust, and I'm just going to talk you through my ARC-GM research internship journey, starting with why I chose to do the internship, what my objectives were, the learning opportunities I had, some achievements, reflections and next steps. So working in one of the largest paediatric metabolic centres in the UK, I provide dietetic support to patients with some of the rarest inherited metabolic disorders, yet understandably, given how rare their conditions are, the evidence underpinning some of the dietetic interventions that we do is incredibly limited. So I want to help change this. However, with very little research experience, I felt that I needed some dedicated time to learn more about clinical research and improve my skill set. So this internship felt like the perfect stepping stone into the world of clinical research. For my objectives, I wanted to obviously improve my knowledge, understanding and skills within clinical research to ultimately then enable me to design my own research project within inherited metabolic disorders and apply for a predoctoral fellowship and subsequently a PhD. So as Penny kind of already outlined earlier on, how the ARC set up and the internship is set up is meant that I had lots of fantastic different learning opportunities, and I'm not going to go through all of them today because of time, but I'll just pick out a few ones that I found beneficial. So the ARC-GM core teaching, the resources, the PPIE sessions and the regular meetings were really, really helpful. And kind of in particular within that, I really valued the peer support, the networking opportunities and the regular supervision, particularly from my internship supervisor, Dr. Sorrel Burden. So when I first met Sorrel, we quickly identified that I would find the Masters of Research module in Critical Appraisal and Evidence Synthesis incredibly helpful, so I was quickly enrolled onto that, and the in-depth teaching that I received here was invaluable. Now I'm just going to talk through how I applied some of those learning opportunities and some of my achievements. So firstly, I was really pleased to pass my Masters module, and I've then gone on to apply that through conducting my own systematic review. As you can see, I have completed the systematic review protocol and registered that with Prospero, and that's been a real learning curve to do this, and I'm still in the process of completing it. I also contributed to a successful grant application and another systematic review protocol, which has also been registered online. And after expressing an interest at work in research, I've now started to attend monthly research meetings, and through that I've become involved in a gene therapy trial where I'm analysing food diaries for my patients that are involved in the trial, and that's been really insightful. I've also completed an audit and delivered a poster presentation on this audit at an international conference in Germany, and I'm not going to go into that in more depth just because of time. And then more recently I have commenced a service evaluation examining our use of parenteral nutrition, so PN, in inherited metabolic disorders. This is something that I've become very passionate about and really started to realise there's very limited evidence around what we do, and so it's something I want to explore further. So I've then gone on to begin to define my own research question, looking into this field, and started to identify some potential supervisors to support me in applying and progressing to a predoctoral fellowship to look into this further. So when I reflect back over the course of the internship, it's been a really good experience, although I feel like it has been a little bit of a roller coaster ride at times. I've definitely felt some imposter syndrome, stepping out of my comfort zone. However, I do feel that I've built confidence over time, and it has been really, really rewarding, and I've become very inspired and motivated, particularly following supervision meetings where I've kind of looked back at what I've achieved and what I want to achieve going forward. Although having said that, it has still been a little bit overwhelming in parts, particularly balancing my clinical work with what my research passions. So that's been a bit challenging, but I do feel like I've been incredibly supported by both those at the ARC and also locally in my own team. So if I think of those next steps, then what I want to do now, obviously I want to complete and publish my systematic review as well as the service evaluation, and I definitely will look to apply for a predoctoral fellowship. And then ultimately what I really want to do is use research on a day-to-day basis to help inform dietetic practice in inherited metabolic disorders in order to improve the efficiency, quality and safety of patient care. Just a few thank yous, obviously all of those at the ARC, particularly my supervisor, Sorrel, as well as a couple of my colleagues down in Birmingham where they're very research active. Their input has been invaluable, as well as obviously my own team in Manchester for releasing me and supporting me in completing this internship.